Chondromalacia patella describes wear and tear of the cartilage underneath your kneecap. Oftentimes it might be referred to as patellofemoral pain syndrome or runner's knee, and relates to instability between the kneecap and the femur. Here you can see, we call this a normal knee joint, where here's your kneecap, here's the femur, this is the white is the cartilage there. And if we look here, a knee with chondromalacia patella, or again, wear and tear of that cartilage under the kneecap, may have inflamed cartilage either at the kneecap or even on the end of the femur. And in a lot of cases, patients that are diagnosed with patellofemoral pain syndrome might be instructed to rest, ice, do physical therapy. There are times that this condition is related to muscle imbalances in the knee, and patients need to work harder on strengthening certain muscle groups to get the kneecap to track better, which again, these are all great things, but there are a lot of people that go through all those steps and fail them. You know, they quote unquote fail physical therapy, fail traditional treatments, and may be left with minimal options or looking at stopping their sport or stop running. Patients with this condition may complain of pain deep underneath the kneecap, like they can't quite press on a spot that will hurt, it's deep in there. They may have clicking, popping. Some may complain of pain when going up and down the stairs. These are all common things that patients with chondromalacia patella might experience. In patients that have this diagnosis that have, not done well with physical therapy, or maybe they have gotten a little bit better, but they're not quite where they want to be, these are patients that we often see for prolotherapy. And if patients are deemed a good candidate for prolotherapy, our whole goal is to work on getting that kneecap to track better in that groove. And it could simply be due to ligament laxity. Patients may have in an injury or with overuse stretched out the ligaments that are supposed to stabilize the kneecap to the femur, or even stabilize your femur and your tibia so that kneecap can track appropriately. And in cases where we do find documented ligament laxity, we are successful in getting them to be able to not only get rid of their pain, but get back to functioning at the level that they would like. If we look here, this is just an example of some before and after x-rays from somebody that had what we call abnormal patellar tracking or instability. And you can see in the top, this is the patella here, how it's slid over on the side. You can see how it has slid over on the side. And then after prolotherapy treatments, you can see that by strengthening the ligaments over here, how that kneecap has started to actually become more midline, become more in the center. And we should note it is often done alongside exercises to strengthen the vastus medialis, but this is just an example of how we help those with chondromalacia patella.